Bismillahirrahmanirrahim. Today we are going to discuss about the fractures of radius and ulna. Before going into the deep discussion, we should know what is fracture. Fracture is basically the anything that will disrupt the continuity of the bone. This is the table of content which we have covered in this lecture. There is introduction, then the fracture of radius of head, neck and distal end. In the last, I will explain you again this slide as we are going to cover all of these topics. The fracture of radius, head, neck, distal end, then fracture of shaft of radius that contains two type of fractures. I will tell you about that, and then in the last we will cover the fracture of Olecranon. Now what is fracture? A fracture is a break or disruption usually in the continuity of a bone. It is present when there is a loss of continuity in the substance of a bone. There are various different type of fractures. Some of the I have going to tell you about that. This is the normal bone. Here you can see that this is totally transverse line, so this is a transverse fracture. They are very simple one. This is oblique. You all know this is oblique line. This type of fracture is spiral fracture. This is a comminuted fracture. Comminuted fracture is the fracture in which the bone is totally broken into smaller pieces. So here you can see that this is a comminuted fracture. Then avulsive fracture. In this, the fragment of the bone is avulsed out. So you can see here that this is the avulsive fracture. This is impacted fracture in which the two parts of a bone are impacted in each other. This is a fissure type of a hairline fracture, but is very easy to heal. And this is a green stick type fracture. So this was the some types of a fracture we should know before going into the discussion. So today we are going to study about the fractures of radius. Fractures of radius are either from the head of the radius, neck of the radius, distal end of the radius or shaft of the radius. Here you can see this is the head of the radius. Okay. This is angulated, this is displayed, this is a total displacement of the head of the radius. It is happen when the person is fall on outstretched hand, and it is very common in adults. And when just below the head there is a neck of the radius. Sometimes it happen, but it is more common in young children. Now the very important topic of discussion is the distal end of radius. Distal end of radius has two types of fractures, that is Colles fracture and Smith fractures. The Colles fracture is a complete transverse fracture of a distal 2 cm of radius. It is mainly caused because of severe injury, more common in 50 years of age, and it is more commonly happen in women. Why in women? Because there is a process of osteoporosis which is happen in women more in very early age, and they will mainly commonly weaken the bones. So this Colles fracture is common in women. It has happened when the person is fallen outstretched hand, and this the Colles fracture has a typical history of a person. He will giving that it includes the slipping or tripping in an attempt to break the fall or landing on the outstretched limb with the forearm in hand in pronated position. The person will give you this type of history. So the fracture results from forced extension of the hand, and usually as a result of trying to ease a fall by outstretching the upper limb. Okay. Now what are the signs and symptoms in any case of fracture? Whenever it has come in to write down about the fracture, you should remember that in any type of fracture, the signs and symptoms are pain and tenderness. Definitely it will cause the pain, and it is very tender in case of when there is a joint is involved. So here you can see the normal hand with a normal anatomical position. This is the lateral view, this is the anterior view. This is the styloid process of radius, and this is styloid process of ulna. Now when the person is fall on outstretched hand, or there is a forced extension of the hand, usually is as a result of a outstretching the upper limb, what happened? The distal fragment of the radius is displaced dorsally. Okay, the distal fragments of radius overrides the rest of the bone, and sometimes along with this radius the ulna is also disrupted or it also everts. But whenever there is a distal end of radius involved, the distal fragment is placed dorsally and it will give a typical appearance of the hand like a dinner fork. So this Colles fracture is sometimes giving an appearance of dinner fork. So it is called as dinner fork deformity. Okay, when it is, comes in MCQs that what is happening in dinner fork deformity, you can easily write down that the distal fragment of the radius is overrides the rest of the bone or it is placed dorsally. So this was the Colles fracture. Now second type of fracture is the Smith's fracture. Smith's fracture is the reverse of Colles fracture. How it is reverse of the Colles fracture? Here you can see in the diagram, this diagram. This is the distal end of radius that is displaced dorsally. But in case of a Smith fracture, the distal fragment is displaced anteriorly. Same it is happen because of the fall on the back of hand. Okay, in case of Smith's fracture, the person is fall on the back of hand and the distal fragment is displaced anteriorly. This is the inward movement of the hand. So what is the treatment of that? The treatment is same. We have to do the normal alignment of the bone and cast will be applied. The healing process in case of distal end of radius is very fast. Why it is fast or bony union is why very good? Because there is a rich blood supply of the distal end of radius. So because of that, the fractures are very much healed earlier. Now coming towards the epiphyseal plate injuries. It is one of the category of the distal end of radius, but as the name indicates, epiphyseal plate. So definitely it will happen in children where the epiphyseal plate is not completely joined with the metaphysis. So here you can see this is epiphyseal plate. In case of very different outstretched hand or fall on the hands or fall on the upper limb, the children will got the epiphyseal plate injury. The fracture line extends through the distal epiphyseal plate. And there the healing process is similarly very fast because of the rich blood supply. Now come on towards very important topic, that is the fracture of shaft of radius in ulna. Whenever the radius is fractured, in many cases ulna is also fractured because radius and ulna are joined together by the interosseous membrane and they will transfer the weight. So because of their very close union, the fractures may or may not occur together. So what happens is that we know that the bicep muscle is attaches over the radius. So whenever the radius is fractured, the proximal fragment of radius especially is supinated by the supinator and the bicep brachii muscle, and the distal fragment of radius is pronated and pulled medially by the pronator quadratus muscle. Okay, be remember this thing. Okay, whenever the fracture of the shaft of radius occur, the proximal fragment is supinated. Why? Because there was an impaction of the supinator and bicep muscle. Okay, supinated because supinator and bicep muscle, and the distal fragment of radius is pronated. Why? Because there is an effect of pronator quadratus and it will pull medially. Okay, the strength of brachioradialis and extensor carpi radialis longus and brevis are basically shorten and angulates the forearm because they have also effect on that. So whenever the fracture occur, the power of the muscle is always strong and they will pull the bone into that direction which has the muscles is pulling. Now the fracture of distal end of radius. There are very two types of important fracture, Monteggia's fracture and the Galeazzi's fracture. In Monteggia's fracture, what happened? In case of Monteggia's fracture, there is a fracture of ulna, fracture of the shaft of ulna by a force applied from behind. The force is applied, the fracture occur, and along with that, there is a bowing forward of the or anterior dislocation of the radius. Why the radial head is dislocated? Because there is a rupture of the annular ligament as well. So there is a bowing of the ulnar shaft. Here you can see whenever there is a fracture of ulna, the force is applied from behind. There is a bowing of the forward of the ulnar shaft and anterior dislocation of radial head with the rupture of annular ligament. This is termed as Monteggia's fracture. Both the two figures are of Monteggia's fracture. Now the Galeazzi's fracture. Galeazzi's fracture is totally the opposite of Monteggia's fracture. It's a reverse of that. We remember this thing, in this Galeazzi's fracture there is a fracture of proximal third of radius. Here you can see the proximal third of radius is fractured and the distal end of ulna is dislocated. Okay, at the distal radio-ulnar joint, the distal end of ulna you can see is dislocated and the proximal end of radius is fractured. So these two fractures are opposite of each other. The treatment is same, that you have to make the alignment of the bones and apply the cast, or in some cases open reduction internal fixation can also occur. This was about the fractures of distal end of radius. Now in the last we are going to cover the fractures of olecranon. Olecranon process we all knows is a bony process that is subcutaneous and protrusive. In normal layman, people say that there is a fractured elbow. They termed as fractured elbow is basically the fracture of the olecranon. The typical mechanism of injury is a fall on the elbow combined with sudden powerful contraction of the tricep brachii muscle. You can see here the tricep brachii is attaches over the olecranon. The fractured olecranon is pulled away by the active and tonic contractions of the tricep. So it will cause the avulsion of this olecranon. Okay. The fractured olecranon is pulled away by the active and tonic contraction of the tricep, and the injury is often considered to be an avulsion fracture. Because of the traction produced by the tonus of the tricep on the olecranon fragment, the pinning of the bone is usually occurred. Here you can see that the olecranon process is moving avulse outward. Okay, healing in this case of olecranon, or we can say the treatment of the fracture of olecranon, is that often a cast must be worn out, but for the extended period of time. Why? Because the healing occurs slowly in case of olecranon process, as it is subcutaneous and there is less blood supply. So in the end, I'm going to again tell you about summary, that we have covered what is the fracture and what are the types of fractures. Then we have covered the all of the Colles fracture, Smith fracture, which are opposite of each other, Monteggi's and Galeazzi's fracture, which are also opposite of each other. So you have to memorize all of them. Thank you so much. This was about the fractures of radius and ulna.